You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, reversing or stopping sleep apnea. Also, for those of you that snore, or maybe you have a spouse or partner that's snoring, maybe they have to sleep in the other room, you have to hear what Dr. Henninger has to say, because he said he could end all that in one day. With us, we have an expert on this topic. He is San Diego's sleep apnea dentist, Dr. Christopher Henninger. Dr. Henninger, welcome to the program.
Thank you, Randy.
Welcome back. We've had you on the program talking about other things, but you love this whole sleep apnea. And it's covered by medical insurance and Medicare, right?
Absolutely.
Okay.
The insurance companies are very interested in helping people solve the sleep apnea problem because they know the sort of boring side of this is that the health risks of sleep apnea are tremendous. Heart attack, stroke, diabetes, those sort of things are big in the minds of insurance companies.
Okay, so who's a typical patient that you see? Is it the people that don't want to be on their CPAP anymore? Or is it those people that are snoring so loud, their partner's dragging them in your office?
I typically,
who do you see?
Yeah, I typically see two types of patients when it comes to sleep apnea. People who don't know they have sleep apnea, but they may have some of the symptoms, like snoring is a big symptom of sleep apnea. And the inconvenience of snoring is what drives a lot of people into my office. Usually it's the wife dragging the husband in by the coattails saying you have to...
Is it true the wives even make appointments for the husbands?
Absolutely, I get that all the time.
Right?
Like the husband doesn't know why they're there when they show up. It's a little bit awkward, but it's fun too. But yeah, you have these, couples in their early 30s that are supposed to be enjoying married life, and the husband is sleeping in a separate bedroom
because he's snoring so loud.
Absolutely, and those are things that just shouldn't happen. And, from a health standpoint, that's one thing. But, again, the snoring symptom is what drives a lot of people in.
When I first heard about this, the dentists were treating sleep apnea. I said, I don't know, if this is their role. But, as you've explained, these people breathe perfectly fine all day long. They lay down, and now they can't breathe. So there's something going on, right? Their jaw is kind of floating back, or their tongue is floating back?
Sure. So what happens when people have sleep apnea is they're actually sleeping on their back and the tongue falls into the back of the throat. And a partial restriction, the soft palate vibrates and creates that snoring noise. And, in some people, an all-out obstruction happens. So they actually stop breathing. And another symptom that I hear quite frequently is the wife will tell me, yeah, my husband stops breathing in his sleep and it really scares me. So I have to wake him up so he'll start breathing again. I hear that very frequently. And, when you stop breathing at night, your body's going to go into overdrive. And instead of getting that rejuvenating sleep where your pulse rate goes down, your blood pressure goes down, and your body gets a chance to recuperate, it's actually doing the opposite. If you were to sit here and hold your breath for 10 seconds, your pulse rate would go up, your blood pressure would go up, and your heart's going to start working harder to get that oxygenated blood to the brain. And if that happens during your sleep, it's bringing you out of the deep sleep that you need for your body to rejuvenate, and until your body starts to breathe again.
So you wake up tired.
Absolutely.
So is it true? I mean, these people aren't even really sleeping?
Absolutely.
That means they think they're sleeping?
You may not be conscious of the fact that you're not getting the sleep that you need, other than the fact that you're tired in the morning. So you can wake up in the morning, you're like, I feel like I slept all night long, but I'm still tired. I still need 10 cups of coffee in the morning. And that's because you're not actually getting into that deeper level of sleep where you get that rest. You're staying in the stage 1 and stage 2 level where you're not really conscious of what's going on, but your body hasn't had a chance to relax.
And when you don't sleep, by the way, you're like a zombie the next day, right?
Absolutely.
Everybody knows you don't sleep, you don't feel good the next day. You're not ambitious, I should say. You're not in a good mood even.
Absolutely.
You're edgy.
Hey,
Does that go away, by the way, when you make appliances for people?
Absolutely. The fatigue or daytime sleepiness is one of the things that, along with the snoring, that goes away first. Some people have morning headaches, and those are all signals that you're not getting the restful sleep at night. And the oral appliance is really good to treat mild to moderate sleep apnea. And the reason why dentists are involved in sleep apnea, you brought up the fact that it seems kind of unusual that a dentist is involved in sleep apnea. The typical treatment for sleep apnea is the CPAP machine. And the other half, we talked about half of my patients coming in because their wives made them because of snoring. The other subset of patients that comes into my practice already know they have sleep apnea. They're already aware of the dangers of sleep apnea, and they're trying to receive treatment. And the treatment that their physician has prescribed for them is the CPAP mask. And CPAP it works. It's the gold standard in treatment of sleep apnea, and it works. The problem with CPAP is compliance. There's been scientific studies that say that, after 2 years, 60% of people drop out of treatment with sleep apnea, or with the CPAP machine, and then you're back into that same old boat.
So if 60% of the people that have been given a CPAP don't wear it, then the CPAP isn't working, obviously, at all for those people.
If it's in your closet drawer or your drawer at home, it's not working for you. So that's where the oral appliance.
I mean, have you had people that have been on CPAP and now they don't need it because of this?
Absolutely. So we have converted a number of people who were unwilling to wear their CPAP anymore to an oral appliance, and they're receiving the same health benefits or the stopping of the snoring as they were with the
When
CPAP.
you first approached me, you said, I want to talk about sleep apnea because you had been doing it for a while already.
Mm-hmm.
In my mind, I was thinking, are there really a lot of people with this problem? But it's big.
Absolutely.
Is that right?
Yeah.
A lot of people in San Diego have it?
Yeah. They say there's about 40 million undiagnosed people with sleep apnea in the country. So it is widely prevalent. And in sleep apnea, everybody asks me, is this a new thing? And sleep apnea is not new by any means. But the medical profession is getting better at identifying the patients and identifying the disease and giving the diagnosis. That's why it's so popular. And I don't know if popular is a good word, but people are becoming more aware of sleep apnea.
So these custom-made appliances, right? Okay, so why custom over something you could just buy? Because there's a lot of advertising on these inexpensive mouthpieces.
That's true.
So how is this different or better?
So these are custom fit oral appliances. So we will take impressions of your teeth and a bite registration and set these at the appropriate setting for you. So the over-the-counter devices are not FDA approved for the treatment of sleep apnea. These oral appliances that we make are custom fabricated for you, and they're also adjustable. That's the key component to these devices, is that just because we put an appliance in your mouth doesn't mean it's going to be 100% effective right away. It has to be adjusted, and that adjustment has to be monitored, and you have to be tested afterwards. So I know there's a lot of people out there that have tried the oral appliance, maybe from their dentist, and the dentist put it in and said bye-bye, and you've gotten this feeling that it just doesn't work. Well, they have to be properly titrated, just like a CPAP mask. It's got the dial on there. You have to find out what the right pressures is for you. The appliance is the same way. It has to be adjusted, and those adjustments have to be monitored by
So
somebody.
you see sleep apnea patients every day in your practice?
Every day, yes.
And when it's all done and they're back to sleep, right? Or maybe they're back in the bedroom with their partner or spouse. Did they tell you these stories? Like, oh my goodness, you gave me my husband back, or whatever.
Yeah, my favorite reaction to our treatment is, and I get this very frequently, probably once or twice a month, I'll get a card in the mail. And it's kind of unusual for me to get, handwritten mail at the office, but I'll get a handwritten card from a spouse saying, "Thank you, you've changed my life."
Wow.
And I'm like, you're not even my patient. But the fact that we've gotten the husband better has dramatically changed the spouse's life as well. And we pick on the guys a lot, but it's not, guys aren't the only ones that have sleep apnea. I get the reverse story about females too. We just don't pick on them as much.
Okay, but it's mostly guys though, right?
There's a predilection towards middle-aged males with sleep apnea, but there's no prototypical sleep apnea patient. Some people have gained sleep apnea through weight gain over the years, and older people are more commonly have it. But some people, it's a skeletal discrepancy with their jaws. They have really small jaws and really nowhere for the tongue to go. We've all seen the patient that has the profile of the really tall face, and their palate is very, very narrow. So I often have this patient. He's a good friend of mine. He's actually in the Navy. He works with the Navy SEALs, and he's a really buff, really fit guy, and he really struggles with sleep apnea. So we never go to the movies with him because he would always fall asleep during the movies. And we're like, this isn't normal for a young individual who's physically fit, and he'd wake his wife up at night. And so we finally convinced him to go get tested and see.
A sleep test.
A sleep test.
Okay.
Yeah, it was a home sleep test, so he did it at his own house. He didn't have to go to a sleep lab. And what we found out about him was that he stopped breathing for 10 seconds or more 15 times per hour on average. So that's 15 times that he was waking up and most likely waking up his spouse. So we got him fitted for the custom appliance, and we now can go to movies as a couple together because he can make it through the whole movie without falling asleep. He's more active at work. It's just really changed his personality and who he is during the day. He doesn't wake up with the droopy eyes and struggles to get going during the day. That part of him has been changed.
So
it's
if
really
people
nice.
are watching this and they're told that they are loud snorers by their spouse, right? I guess if you live alone, this becomes a problem, right?
Absolutely.
And if they wake up tired quite a bit, they probably have something going on. Is that fair to say?
Absolutely. So even if you don't have what we call a bed partner, the other symptom that really brings people in is the daytime sleepiness. So like you feel like you're in this fog. I had a patient describe this to me. They're like, after we fitted them with the appliance, they started feeling better, and they're like, if I feel like a fog has lifted that I didn't even really know was there. So it was just sort of this general tiredness that maybe they just thought was part of life and normal. But getting them successfully treated with their sleep apnea, they felt like things were more clear.
Because when you get a good night's sleep, you wake up feeling like, you feel good.
Yeah. And we all know what that feels like to get a good night's sleep versus a bad night's sleep. And when those bad night sleeps start to outweigh the good night's sleep, that's how you probably should be tested, or if your wife is.
Help me understand the diagnosis. Somebody, let's say, they know they have it. They have a CPAP, but they hate wearing it. Or maybe the chronic loud snorer. What's the diagnosis like? Like, how do you figure this out?
Yeah. So if you're undiagnosed with sleep apnea, but you feel like you have some of the symptoms, the first step is sleep testing. And there's two types of sleep testing. There's the in-lab sleep testing that probably everybody's heard about. The way we do it in our office is through home sleep testing. So we have this device that you'll wear for 2 nights, and you bring it back to the office.
What does it measure? Just movement or oxygen?
No, it measures
or
6
what?
or 7 different things. So it measures airflow. So it has a nasal cannula that measures airflow. It measures whether your chest is rising and falling with each of your breaths. It measures the saturation of oxygen in your blood. It measures like the positioning in which you're sleeping, because sleep apnea is worse when you sleep on your back. So it'll measure how much time you're spending on your back. And then the loudness of your snoring. So it actually measures, and it has a microphone and measures how often and how loudly you're snoring.
They do it for 1 night or a couple of nights?
I usually do a 2-night just so we get enough data. And then once you're diagnosed, like I said, mild to moderate sleep apnea cases are, the oral appliances are really good first line of treatment for that. If you have severe sleep apnea, I do ask my patients to at least attempt CPAP. But we have the second type of patient that comes to me has already tried the CPAP. So they're already diagnosed, already tried the CPAP, and they just can't do it for whatever reason. It's uncomfortable. I travel a lot. I like going camping with my son, that sort of thing. Those patients can also be treated with sleep apnea. We just have to monitor the results closely. And we do sleep testing after we've delivered the appliances for patients, just to make sure we've cleaned up all of the sleep apnea. So after we've delivered the appliance, it's usually you'll almost feel the results almost immediately. The first time that you wear it, if you're really struggling with snoring and daytime sleepiness, I'll often have people tell me the first night the snoring was all gone, or I instantly felt better the night before. But I do tell people that it does take a couple weeks to adjust the appliance to get it to that optimum setting, because I do start you out at a very conservative setting to begin with. We don't want to cause any problems with your TMJ or move any of your teeth. But I do oftentimes, when people come back for their follow-up visits, feel like it's magic. It's just gone.
Is that right?
Yeah, it's quite striking.
Now, one of the doctors here in San Diego, Dr. Henninger, had sleep apnea.
Yeah.
Right?
He did.
And you treated him. In fact, he works with you.
He does. He's my partner.
Okay. So how did it go for him?
So here's an interesting story. When we started doing sleep apnea, he sort of had some of the symptoms, and he had talked to his doctor about it. And his story was his doctor wanted him to have the palatal surgery to help with his snoring and sleep apnea. Okay. And he just didn't want to have surgery. And I totally understand that. There's some recovery that's associated with that, and surgery is just not fun. And so he'd been putting it off, and we sleep tested him in our office. Yeah, we did. And he had a moderate case of sleep apnea. So I said, hey, look, these oral appliances I think could help you. And he had gotten to the point where he felt like his wife was always mad at him, and neither
Because
one
he
of
was
them,
snoring so loud.
neither one of them really knew why they were mad at each other. But as it turned out, like he was disrupting his wife's sleep through snoring.
Okay.
And I think so subconsciously that was the reason why she was always sort of a little bit upset with him. And once we got him into an oral appliance and, the snoring went away, they seemed to like their relationship got better. It was kind of interesting. And I say that kind of jokingly, but it's the truth. Like Sherry, his wife, will say, we'll really encourage him to wear the appliance because she wants to make sure she's getting it.
So I asked him too, because I've heard from other people, they're very uncomfortable. Would that be more of the older style as opposed to today?
Yeah.
Because Dr. Hudegard says it's comfortable.
Yeah, they're passively fit over the top of your teeth. And again, they're custom made for you in such a way to be comfortable. So they need to be made by somebody who does this on a regular basis, and you need to be monitored by somebody who does it on a regular basis too. I do hear the story quite frequently that I've tried this many years ago and it just didn't work for me. I'm like, well, tell me a little bit about that. What was your experience like? He's like, well, the dentist made it for you and put it in and it just didn't work. I'm like, did you go back for your follow-ups? Was it adjusted at all? He's like, no, none of that. So again, a key component to this is that not only do you get used to wearing it, but we get it adjusted or titrated into the right position.
What's the easiest, by the way, are the loud snores, that means that not quite sleep apnea, but the loud snores, are they the easiest to treat?
Yeah, snoring
like you could wipe out snoring?
Snoring is the first thing that goes away. So by moving the jaw forward just ever so slightly, the tongue has more space to live and air has more room to get back behind the tongue. So snoring is usually relieved very early on in the treatment. But I am concerned also not only with the snoring, with the apnea or the stopping of the breathing. So I want to help out with the snoring, but I also want to make sure you're getting the restful sleep that you need for your overall health.
Now these people that have, they don't wear their CPAP, even though they know that they could die of a heart attack in the middle of the night, right? That doesn't seem to scare them enough, right?
Yeah,
isn't it hard? It's a hard group to work with to get them to believe that this works.
Absolutely.
Is that part of this?
Yeah, and where it really hit home for me too, I was even skeptical, that sleep apnea could cause a heart attack or a stroke in the beginning, but this really hit home for me with one of my patients. Her name is Candy, and she lived by herself. Her husband had passed away, and she didn't really know she had any problems, and all of a sudden she stopped coming to the dentist. And she came back, and I said, Candy, where have you been? And I did a cosmetic makeover for her. So I was, we had a bond there. And I sort of jokingly said, Candy, I want to be able to check up on your smile that I worked so hard on. I said, where have you been? She's like, I had a heart attack. I said, really? I was like, you're pretty healthy. She's like, yeah, I've never taken medicine in my life. And she's like, I'm really perplexed at, how or why this happened. And I was like, how's your sleep? Do you sleep well? She's like, oh, my husband used to tell me I snore a lot. And, she went and got sleep tested, and she found out that she had severe sleep apnea. And, through me just asking her some questions about that, she's like, my physician really couldn't even figure this out. But I really believe that, having the sleep apnea for a long period of time is what has led to this major event in my life, having a heart attack.
It's very nice. The other nice thing, look, we have this medical show for the last 17 years, medicine and dentists. And the medical, and I know your wife's a medical doctor, but the medical doctors now are asking about sleep. And they're starting to realize that dentists with these custom-made appliances can get these people sleeping again.
Absolutely.
And probably extend their lives.
Yeah, and I think they realize that, especially primary care doctors, they realize the struggles that people have with CPAP, which is the traditional treatment. And so that's why, we're starting to see a lot of physicians refer patients directly to us for oral appliance. They realize that it may fit into people's lifestyle a little bit better than the CPAP machine. And I have some people, don't get me wrong, I am a big fan and a proponent of CPAP because I know it works. But if it's not working for you, I want to know that there's an alternative. And some people use our oral appliance in what I call just occasional use. So those times that they're burned out on their CPAP, if you're wearing an oral appliance, at least you're still treating yourself. Maybe the CPAP is a more optimum treatment than the oral appliance, in your particular case, but wearing the oral appliance is better than nothing, which is what happens when they rip that CPAP mask off during the middle of the night. I have a lot of patients who are actually doing quite well with their CPAP, but there's just something in their life that the CPAP doesn't work work into.
Like if you're going on a family trip or a trip, on a school trip with the kids.
Right, absolutely.
You probably don't want to be seen with a CPAP.
Yeah, so the biggest story I get from a lot of my dads with kids is, we all like to go camping with our kids, and you can't really take your CPAP machine camping with you, but yet you don't want to be the guy in the tent that's keeping everybody else up at night through the snoring. So I have some people who use the oral appliance for what I call occasional use.
Okay.
The business traveler, they like their CPAP. They're not trying to get off of it. When they're home, it works for them. But when they travel, it just doesn't work for them at that point. So, they'll have both. They'll wear their oral appliance when they're traveling and wear their CPAP when they're back home. And I think that's a really optimum situation because, we know in some, especially severe sleep apnea, that CPAP works better.
Okay.
But the oral appliance is better than not wearing your CPAP machine. So again, a lot of people, I hear the camping story over and over again.
Now we need to mention too, look, this is a real interview. I'm not trying to endorse you, but there's no doubt about it, because I've done the research on this particular topic, and that is that probably 9 out of 10 of the offices across the country don't take medical insurance. That means dentists aren't taking medical insurance. They're not set up for medical. Right. You take insurance. Medicare is covers this. And so does a PPO or HMO. Yeah. So you'll take insurance.
Absolutely. So
on all of these.
Other than physicians really not knowing what the oral appliance can do, the other big barrier for patients to get this particular treatment has been the billing part of it. Yeah. And one really unique thing about our dental office is that we have the team in place to be able to bill medical insurance. And these appliances are covered by most major medical insurances and also approved by Medicare.
Now, what about the VA? Because you're in the military.
Absolutely.
I mean, they're completely not covered, though.
No, that's absolutely untrue.
Is that right?
The VA does not have providers that provide this service, and so they get referred out in town. And so I do get a lot of referrals from the VA, and the VA pays for your treatment in my office too. So
if you're loud snoring, especially if you're wearing a CPAP, it's worth a shot if insurance is going to cover it to see if you could bridge over.
Absolutely.
Right?
The first step, like we talked about last time, is making sure you're diagnosed. So if you haven't been diagnosed, we got to get you into a sleep test or a sleep study. But if you're struggling with your CPAP, there may be another way to do this for you. And I have this one patient in my practice. His name's Jason, and he's my age, and he has 2 teenage daughters that we took out his wisdom teeth, and a wonderful wife that they're unable to sleep in the same bedroom together because of his loud snoring. And, we got into this discussion. I was like, it doesn't have to be like this. Let's see what's going on. So we sent him home for a sleep study, and he was literally stopping breathing in his sleep 15 times for 10 seconds or more per hour. So he was tired all day.
So that means he's actually waking up.
Yeah, absolutely. Right. Whether he was conscious of it or not, he was getting out of that deep sleep into the lighter sleep and not getting the refreshment that he should be getting out of his sleep. Okay. So, he was a small business owner, and, he was just sort of dragging himself through his day. And I was like, this is not normal for somebody your age. I mean, you're young, you're thin, you're not overweight. And so we got him sleep tested, and, we found out that he had moderate sleep apnea. We treated him with an oral appliance, and, it was really empowering for me to hear that he was able to get back and sleep in the same bedroom as his wife again. And I think those are the kind of things that people, they take for granted, and they start to think, maybe being tired is normal, or maybe, snoring loud, that's just who I am. I mean, we all have this sort of crazy uncle that, falls asleep on the couch and starts to snore. And those things that we start to accept as normal are not normal. And maybe a simple solution like an oral appliance can treat that.
Good. Now, because I had a friend of mine, he goes, what do you think about these sleep apnea appliances that dentists make? He goes, but I don't have a tough time sleeping. He goes, I could sleep whenever I want. I could sleep during the day. I could take a nap anytime. Right. And I go, that's probably a big sign. I go, because I can't sleep during the day.
Absolutely. So taking frequent naps is a sign of you not getting the sleep that you're supposed to at night. You sleep 9 hours at night, and then still have to take, the lunchtime nap, those are things that are not normal. Having to drink 10 cups of coffee just to feel like you get yourself out of bed, that's not normal. You should be able to sleep, between 7 and 9 hours a night and feel refreshed the whole day.
We're short on time, but if somebody watching this comes in for the free consultation, with what level of predictability can you say you're going to be a good candidate for this?
So it's really easy if we have a sleep study. So if you already have a sleep study, it's really easy to tell you whether I think this is going to work for you or not.
And at home, they go home with it.
Yeah.
Okay.
So if you haven't been sleep studied yet, I can send you home with a home sleep testing machine and really figure out what's going on there. But I usually can, by your symptoms and also, by just doing a simple exam, really tell if I think we're going to be able to be successful. We also have a CT scanner in our office that we can take a three-dimensional airway and do like a volumetric analysis of your airway and see if your tongue is likely to fall back and impinge upon that airway. So there's a lot of diagnostic tools that we can use to sort of figure out if you're a good candidate for an oral appliance. So again, there's no risk in coming in and finding out, I'll show you the appliances, I'll do an examination. And
you like this sleep apnea thing?
I do, because it's just...
I was talking to your office manager. She goes, he loves this sleep apnea thing.
Yeah. And it's not, again, it's just like dental implants. I do technically...
Because it works.
Yeah, absolutely. And you see a big change in people's lives. And that's what really motivates me to go to work every day and do what I do, is when I know I can make a change in somebody's lifestyle.
I know a young couple, and I have to be careful because they may watch this show, newly married. The husband has a really loud snore, like really loud. This guy's under 40 years old, loud snore. And some nights, if she's got to do something important in the morning, he has to sleep in the other room because she can't sleep. Absolutely. And I've done my best to try to talk this guy into seeing you. Yeah. I said, just go in. Well, no. And he ordered something online and it didn't work. And he says, no, I'm fine. Yeah. Are there a lot of people like that? See, to me, if I knew there was something that you could possibly correct, I would do it.
Yeah. I think it's the male personality. We're reluctant to admit that there's a problem.
And plus we put it off.
Yeah, absolutely.
Especially doctor visits.
Absolutely.
So what do you say to this guy that's watching this, right? And he knows who he is. What do you say?
If snoring's your problem, that's a really easy thing to treat. Yeah.
So come in, get it. Is there any science that shows that loud snoring ends up leading to this obstruction? Possibly?
Absolutely.
So you're headed for disaster?
Like I said, snoring is one of the first symptoms of sleep apnea. So it may start out as mild snoring. It may be just snoring, but as things progress, the snoring usually turns into the gasping, the choking, the stopping breathing at night.
Okay, good. So if they want to know more, they could go to your website, free consultation.
Absolutely.
You bill medical insurance. It's all. Do you give them the paperwork where they get it done themselves, or you do it for them?
No, we actually have a medical biller in our office that's been trained to bill medical insurance. Most dentists are really good at billing dental insurance. It's pretty easy. But medical insurance, it's a whole nother level of knowledge that's required to be able to do that. And that is one of the services that we provide in our office.
Okay, good. I want to thank you for coming to the show. Always a pleasure to have you on.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.